meeting to order. We will now resume meeting number 34 of the House of Commons Standing Committee on Health. I would like to remind the participants of the following points. Please wait until I recognize you by the name before speaking. A reminder that all comments should be addressed through the chair. Members, if you wish to speak, please raise your hand. The clerk and I will manage the speaking order as best as we can. Last meeting on both sides.
Order. Last week we sent in a 106 letter.
I'm coming to there. I'm coming.
Wait.
Just wait. Just if you can wait, let me read. When I go to that business, then you can raise the point. Pardon? Okay. I know, understand. I, as a chair, fully understand what my duties are and what my powers are, and I will not read those, and I will do those. And if you can let me finish first, then you can raise point of order if you need to. Okay? So let me finish this first. Last meeting, I was happy because we almost met or exceeded the expectations. So I don't need to read those duties of the chair and the powers of the chair. So I want to thank both sides for doing what you fellows did, and I expect better moving forward. Before we begin, I would also remind members that where possible, motions should be submitted by email in both official languages so they can be circulated without taking time away from matters currently before the committee. This is just a request. Pursuant to Standing Order 108 and the motion adopted by the committee on Tuesday, September the 23rd, committee shall resume its study of Canada's pharmaceutical sovereignty. The committee suspended its meeting on Thursday, May the 28th, during debate on the motion of Dr. Doug Ifolson and amendment moved by Mr. Dan Majian. However, I received a request by 5 members under Standing Order 1064 to convene a meeting to discuss a request to study the prescribed IT program, invite the Minister of Health, Madam Missouri Michael, and summons the former Canada Health Infobase CEO Michael Green to testify as part of the committee's investigation. I want to remind you the procedural reminder, section 20.98 of the House of Commons Procedure and Practices states, if the committee has an ongoing yet suspended meeting, it will resume the suspended meeting with the timelines prescribed by Standing Order 1064 and decide how it wishes to consider the request. Therefore, at this time, I would like to look to see if the member wishes to move a dilatory motion to consider 1064.
Yes.
Okay, so there is a dilatory motion that members want to proceed. The clerk, call the vote, please.
Don't I get to speak on it first?
No, just we have to take the vote. Okay.
Ms. Chi.
No.
Voting. Voting is in place. I'm going to
Point
clear
of
one more
order?
time.
I needed explained to me what it is I'm voting for. Could you
That's what I'm
please
going to
read
explain.
that?
I'm going to explain
Thank
that
you.
clearly. So the committee is voting because there is a section 1064. So the committee is voting a motion to consider 1064. So if you vote yes, if we vote yes, then we will go to 106.4. If the committee votes no, then we go to Dr. A. Opson's motion as it was
Point of order.
in the suspended meeting. Yes.
Can you please read the letter of the 1064 that was issued by 5 members of the committee?
The members already have that. The vote is in place right now.
Can you please read it into the record, please?
I tell you right now, the members all the members have that copy, and I have already called the vote. So clerk, please take the vote.
Point of order.
There's no
This
points
is
of order
not-
in the vote now.
This is not appropriate to Canadians watching this. They're not even sure what we're voting on. It's not appropriate. You need to read it. I'm sorry, Chair.
It's my discretion. Please go ahead. The vote is
Ms.
on.
Chi,
No.
Mr. Alfson,
No.
Ms. Jagsek,
No.
Mr. Rana,
No.
Mr. Bordesi,
No.
Ms. Sidu,
No.
Mr. Bailey.
I'm confused. They're voting no on Doug's motion?
No, it is, you are voting, I'm going to clear one more time. We are voting on, because I already read, the committee suspended its meeting on Thursday. I'm not supposed to do it time and time again during the voting, but I'm doing it in courtesy because Madam Kornars asked as well. The committee suspended its meeting on Thursday, May the 28th, during debate on the motion of Dr. Doug A. Ofson and the amendment moved by Mr. Mazier. However, I received a request by 5 members under the Standing Order 1064 to convene a meeting to discuss a request to study the prescribed IT program and invite the Minister of Health, Missouri Michael, and summons the former Canada Health Info CEO, Michael Green, to testify as part of the committee investigation. So if, Madam Kornaz, I just want to clear that I read it before, but I read it second time just for courtesy call, okay?
Mr.
So if you are voting yes, we are going to section 106(4). If we are voting no, then because the committee was suspended, we will go to Dr. A. Opson. Okay? You clear, Mr. Bailey? Thank you.
Mr. Bailey. Mr. Bailey?
Yes.
Ms. Corrales?
To an yes to an
Mr.
emergency meeting.
Mr. Mazier?
Yes, to talk about prescribe IT and $300 million of waste.
Mr. Strauss?
Yes.
Mr. Blanchard-Jonca?
Oui.
Speaking guest. The motion is defeated. We're going to the study as we were studying. So we have 2 speakers on to the amendment brought by Mr. Mazier. 2 speakers. We had Mr. Mantel. So Dr. Strauss, he's not here. And then we have Dr. A. Opson.
Point of order, Chair. So I take it from the motion or the vote that we just had that we will not be pursuing the 1064 at this time, or is it that we will not be performing pursuing the 1064
At this
at all?
time.
Could you advise us as to when we would be pursuing the 1064?
I have an amendment on the floor. Right now, we are debating the amendment, and let me finish that business that's on the floor right now. So there's an amendment brought by Mr. Mazier, and if there is no speakers on the list, then I will call the vote.
Am I supposed to speak now?
No, because it's amendment. If you want to speak, you're welcome. But otherwise, because I'm giving you another chance.
So can you read, so where are we discussing who's on the list and who's next to speak on the list?
Speaking on the list was Mr. Mantal, who's not here today.
Yeah.
And then there was Dr. A. Opson. He have not, you want to speak or no? You want to speak,
Okay,
and then
what is he about to speak on?
is on your amendment.
Which is, okay, if you could read that as well, that would be great. So
Add up
so
to the
we're all
Public
back-
Health Agency of Canada the following, Minister of Health.
Okay.
Okay?
So
You understand?
this is on the amendment to bring in the
That
Minister
you
of
brought
Health.
forward.
Okay.
Okay? Sorry, Mr. Mazier brought forward. I shouldn't say you.
And it was about prescribe IT, or what was a total amendment? If you could read that into the
The
record.
whole motion and, okay.
Yes, please.
Okay, so I'm going to read the whole motion now, even though I'm not supposed to, but just courtesy's sake, I will do that. Okay, this is the motion brought forward by Dr. Doug A. Opson that pursuant to Standing Order 1082, Standing Committee on Health undertake an urgent study on the rising rates of HIV infections in Canada, with particular attention to the recent declaration of a public health emergency by the province of Manitoba related to the spread of HIV, including the disproportionate impacts on Indigenous peoples, women, rural and northern communities, and individuals experiencing homelessness, mental health challenges, and substance use orders. That the study examine federal programs, funding prevention strategies, access to testing and treatment, harm reduction initiatives, public awareness efforts, and intergovernmental coordination related to HIV prevention, care, and support services. That the committee hold no fewer than 2 meetings on this subject. That witnesses include officials from Public Health Agency of Canada, representatives from Manitoba Health, Indigenous health organizations, frontline community organizations, medical and public health experts, and individuals with lived experience, and that the committee report its findings and recommendations to the House. This motion has been circulated in both official languages, and I'm certain that members have got that. Mr. Blantyre-Jonker, you had that from the last time, right? It's been, okay, thank you. And then Mr. Mazier brought forward an amendment. So he bring in that the motion be amended by adding, after Public Health Agency of Canada, the following: Minister of Health. Got it, Mr. Mazier, now? Okay, thank you. So we are debating on the amendment brought forward by Mr. Mazier. So the floor is with Dr. A. Opson. Please go ahead.
Yes, I would just like to reiterate, I wholeheartedly support Mr. Mazier's amendment.
Any other speakers? No? Okay. So there's no more speakers. Is there unanimous consent of the committee to adopt this amendment? Yes, there is a unanimous consent. The amendment is adopted. So now we are back to the motion as amended. So motion brought forward by Dr. A. Opson, amendment brought by, as amended by Mr. Mazier. So we are speaking on that, and we have Dr. Strauss to speak on that one. Dr. Strauss, please go ahead.
Thank you so much, Chair. As everyone on this committee has heard from me already, I'm really looking forward to this study. I think the HIV crisis in Manitoba is really a crisis. I think there's important work that this committee could do, but there's still this issue of basic fairness, and they do something, we do something, and that's the fairness that we extended to them. So I'm looking forward to voting for this motion at some point once I understand what the schedule will be thereafter. In particular, I am very excited to move forward to the 1064. So once I'm done speaking, if perhaps some members of the Liberal Party on our committee could delineate when they intend to allow us to move forward with this very important 1064 that many, many Canadians have written to this committee about the necessity of seeing, then we wouldn't have to drag things out any further, I think, on that point. So I look forward to them saying something about that. I invite them to. But before I finish speaking, I'd like to move the following amendment to Dr. Elfson's motion. That the motion be amended by adding, after the words recommendation to the House, the following: no later than July 2020, 2026, that for the purpose of completing this study and ensuring that the report is tabled by July 22nd, 2026, the committee continue its work through the summer, if necessary, and the chair be authorized to schedule meetings related to the study after the House rises for the summer, and that the committee report to the House requesting permission to table this report after the House rises for the summer, if necessary. And if I could speak to it for a little bit after having introduced
I'd
it.
like to see if you have this in both official languages.
Sure. Would you like me to read it in French as well, or has it been emailed?
If you can read it in French and distribute, that would be very
Certainement.
kind.
Que la motion soit modifiée par
That the motion be amended by adding the following after the words in the House. at the latest by June 22nd, 2026, in order to complete the study, and after the presentation of the report in the House, at the latest by June 22nd, 2026, that the committee continue its work over the summer if necessary, and the chair be authorized to call meetings in connection with the study after the House rises for the summer, and that the committee report to the House to ask for authorization to table this report after the House raises for summer if necessary.
That's difficult.
Okay, so everybody is good with the French and English versions? I see no objections. I'm very happy. So Dr. Strauss, floor is with you.
Yeah, I just wanted to add, like, I present this largely to underscore how important the study is. I don't think that it quite rises to emergency. A committee report is never an emergency, but it is urgent. Like, this is a rapidly escalating problem that our friends in Manitoba are witnessing. So I think if it is as important as we all agree that it is, that this committee should certainly not hesitate to get its work done over the summer. So I hope everyone will vote for this. Thanks.
Thank you. I have a speaking order. I have Mr. Bailey, then Madam Konaz, and then Mr. Mazier. Okay. Okay. Mr. Bailey, please go ahead.
Thank you, Chair. I wanted to comment, at one point, Mrs. Sidhu had included a statement that I don't see in this motion, and I'm wondering, I thought we voted on it, and that was the LGBTQ that we talked about. And I'm just wondering if we've decided that we're not going to include that. And I bring it up because this month is extremely sensitive, being June and Pride Month. So was it something we've overlooked? Thank you, Chair.
It is my understanding, Mr. Bailey, that at the last minute, the committee decided to go as it is, right? Agree? And Madam Sidhu can speak better. Madam Sidhu?
I think we didn't go for that, and then we unanimously.
There was there was some
Yeah,
discussion between the.
It was unanimously
right?
passed.
It was
Unanimously passed.
right?
Yeah.
Okay. So it should be there.
It should be there.
It
Yes.
should be there because it's unanimously passed.
Okay. Sorry. Yeah, it should be there.
So just so I'm clear, when do we get that into the motion? At what point does the clerk, will have to redistribute it with that statement
With
in,
that-
or we just understand it?
We because it's already in the motion is passed. This is in the proceedings of the committee.
Yeah.
So once we passed the sub amendment now.
Yeah.
Brought forward by or amendment brought by Mr. Mazier. So now we brought another amendment by Dr. Strauss.
Yeah.
So once committee goes back to the motion as amended and adopts this, and then we will circulate you that wording again to make sure, and we will read it, the final version, just to make sure that everyone is on the same wavelength. But thank you for pointing out, this is a very important
Thank you,
subject.
Chair.
I appreciate
Thank you.
that. So,
Thank you.
So it means members are are doing their work that they should be doing. So thank you, Mr. Bailey, and you should do that. Yes.
Just a point of clarification. I think syphilis was not there. It's passed too.
Yeah, we passed that too.
Brought it up, and so those two, but now I get it.
Yeah.
Once it's passed, we'll
Whatever
bring
the
it.
final wording is,
Yeah.
the clerk will distribute that, or we will read it. Once the amendments are done, we will go back to, once we are ready, once we call the vote, then I will read the final version of the motion as amended, right? Make sense? But I appreciate, Mr. Bailey, you have done extremely good work here, to remind members. Okay, thank you. You still have the floor, if you wish.
Thank you, Chair. That was my question.
Okay, thank you. Madam Konaz?
Yes, I just wanted to speak to Dr. Strauss's amendment, and I agree with Dr. Olafson. Oilason, I'm sorry, I destroyed your name there. I think this is really important, and again, if this isn't, if this is urgent because of what's seems to be happening in Manitoba, this will be across the country, in particular in BC, as we know, has one of the highest rates of, fentanyl deaths, and extreme, urgent, horrible issue with addiction and use of needles, et cetera. So we definitely need to do this this research for across the country. And also it is so urgent that we're skipping the issue of Prescribe IT, which, as you can see, this was a May 5th issue.
Come back to the topic, if we
Yeah,
can focus our
so the
thing.
topic
Because
is-
these props and stuff, I would not let it go.
Oh, no?
Because you understand, last time we had a very good meeting. Now we are speaking only to the amendment brought by Dr. Strauss. If we can just focus on that dates, and that, I would really appreciate that, because otherwise it makes my heart, because I get, heck from both sides, right? So I have to be very fair to everyone. And so please continue with Dr. Strauss's amendment.
I know it's really important to all members around this table that we address the issue with the HIV, and that is very important to myself. I know that we've had to skip the 106.4, where we're not able to look at Prescribe IT because this is so urgent. I'm hoping we will go back to that, but in the meantime, I think it's so urgent that if we need to work over the summer, we should.
Mr. Major.
Thank you, Chair. And I just echo my colleagues' thoughts around the urgency of this. And as I commented in the other meeting, this Manitoba is probably ground zero for HIV and any type of blood infections. And as I as well mentioned the other day, whatever we're doing in Manitoba is not working by what's going on with stats. So I very much look forward to discussing this over the summer. I think there is, I do have some concerns about how much engagement we're going to get from our minister on this. Because yesterday I was in Finance Committee and I asked her point blank if she was willing, if she would come to Health Committee and explain what was going on with all these emerging issues in healthcare, in her file. And she said, she would not commit, those were her exact words, which sent a very clear signal that she was not willing to come to this committee anytime soon. So that is quite disappointing. And I would urge committee members from the Liberals to encourage her to come to this committee meeting before the House rises to get a lot of these issues figured out. And one of these topics we could discuss is the HIV issue that we have in Manitoba and across Canada. And then as well, we could also get to the bottom of the Prescribe IT issue, as well as many others like Grifols and everything else that we have going on in the Health Committee as well. So if the Liberals are really going to take this as a serious issue, I would encourage the Health Minister to come out as part of this study as well. So
Thank you.
Thank you for this.
Thank you. I just want to remind honorable members that as chair of the committee, if I'm chairing, if Mr. Major, you are in the chair, we have the duty and the power to call committee meetings during summer. So the honorable members are very clear that we as a committee, we can call those meetings, and I as a chair, we don't have to take permission from the House or anybody else. So it's very clear. Any more talking or debate on Dr. Strauss's amendment? I don't see any. So is there a unanimous consent in the room to pass this amendment?
Do you have a
Yes, I
recorded
see.
vote?
A recorded vote? Sure. Okay, there is a recorded vote called. I will call the clerk to take the vote. Please take the vote.
Ms. G,
Oh, yes.
Mr. Allison,
Yes.
Ms. Jacek,
Yes.
Mr. Rana,
Yes.
Mr. Baldezi,
Yes.
Ms. Sidu,
Yes.
Mr. Bailey,
Yes.
Ms. Gonans,
Yes.
Mr. Mazier,
Yes.
Mr. Strauss,
Yes.
Monsieur Blanchet Joka.
Oui.
Need a copy.
Document sur les pesticides.
The amendment.
Amended. So now I'm gonna, because Mr. Bailey brought a very good point, and I'm just in the process, if I can suspend just for 1 minute, and, huh? to the amendment brought by Dr. Strauss. And
Chair.
the amendment.
Chair? Just for a point of clarification, so if this amendment in this motion does pass, who is next to speak on the list?
Then we go back to the motion as amended. Then there will be
I'm complete, if the motion passed as amended, then is there anyone on the speaking list?
there's no.
I would like to be on
Okay.
that list
But I
first,
mean,
please.
when I come to that stage,
that
I
o-
will,
so
I would
that's-
not entertain that now,
I
because the
just
people on the
requested
other
it.
side has come to me as well.
Do we
They
have
said-
unanimous consent that I could speak next after this
No,
motion? is-
no, okay, because there's not,
No?
we're suspended right now. So let me, okay.
we're not.
Mr.
already
Strauss,
came to you?
Mr. Strauss, you have the floor. Dr. Strauss, please go ahead.
Thank you, Chair. I just wanted to ask, now that we're back, we've gavelled in, if either myself or Mr. Mazier could have the, I'm happy for this amendment to go on unanimous consent. I would just like to make sure that we're able to get on the speaking list after that. I have your
I
assurance?
go one step at a time.
Yeah, yeah.
I'm doing my job as a chair.
Yeah.
And I cannot promise things long before. I have to do one step at a time, Dr.
Okay.
Strauss. And honestly, I tell you right now, I act as fair as I can. I'm a human being. I might make some mistake, but I tell you right now, my intent is to be 100% fairness to all sides here. Okay? So if we do not have any more speakers on the list, so we are going to take a vote on the amendment brought forward by Dr. Strauss. Is everyone agree with that amendment? Unanimous? Oh, we already voted. Yeah, we adopted 11 to 0, yes. Okay, so now we're going back to the motion as amended. So the motion you want me to read one more time or no? No? I know Mr. Strauss is on the list, but don't you worry, okay? So is anyone want me to speak the motion into the record? Okay, Mr. Blanchett Jonka, you got the motion in both official languages though, right? And you still want, okay, I'll read it and make sure that you're happy with it. Now we are going to be debating on this one. That pursuant to Standing Order 1082, the Standing Committee on Health undertake an urgent study on the rising rates of HIV infections in Canada, with particular attention to the recent declaration of public health emergency by the province of Manitoba related to the spread of HIV and syphilis, including the disappropriation it impacts in specific regions and populations, including 2 SLGBTQI+ communities, on Indigenous peoples, women, rural and northern communities, and individuals experiencing homelessness, mental health challenges, and substance use disorders. That the study examine federal programs, funding prevention strategies, access to testing and treatment, harm reduction initiatives, public awareness efforts, and intergovernmental coordination related to HIV prevention, care, and support services. That the committee hold no fewer than 2 meetings on this subject. That witnesses, including officials from Public Health Agency of Canada, the Minister of Health, representatives from Manitoba Health, Indigenous Health Organizations, frontline community organizations, medical and public health experts, and individuals with lived experience. And that the committee report its findings and recommendations to the House no later than July 22nd, 2026. That the purpose of completing this study and ensuring that the report is tabled by July 22, 2026, the committee continue its work through the summer if necessary, and the chair be authorized to schedule meetings related to this study after the House rises for summer, and that the committee report to the House requesting permission to table this report after the House rises for summer if necessary. Okay, everyone have this in both official languages? Good, I don't see any objection. So now I have the speaking list. Dr. Strauss, you are on the speaking. Please go ahead.
Thank you so much, Chair. So, as instructed by you, you didn't want to deal with this while we were in the amendment. I guess I just very much want to know if we have some assurance from the Liberal members opposite, if once we vote for this HIV study, we can proceed to an investigation on Prescribe IT. If it is the case that they're willing to go on the record saying that they're willing to do that, then I'm looking forward to voting for their motion. If they are not willing to go on the record saying that they're willing to do that, then I'm looking forward to discussing this motion further. So who's next on the speaking list? Dan, are you on?
Sorry, let me talk to the chair, please.
Oh,
okay. I'm giving you all the time that you need.
I know.
Okay,
Thank
I'm
you.
giving you all the terms you need. I can explain it to you, your question.
Yeah.
I cannot say that because you got to speak through me. If I don't see anyone have a hand raised, so I mean I'm not in a position to answer your question.
Okay.
You see what I mean?
I guess I
the
wanted to-
only
I-
way that question can be answered if the vote is called and whichever the vote goes, because the members can change mind last minute. So,
course.
so you understand that, right? So it's not up to me. It's not up to one committee member. It is to the committee as whole. The majority has to decide how they want to vote on this. So that's what it is. I cannot attach any conditions. I have read the motion in place as amended. That's what we are voting on. That's what we are debating on right now. And if we need to go to, once the list is exhausted, then we'll go to the vote on this one.
Yes,
Okay?
of course,
Thank
I
you.
understand, Chair. I just wanted to make space. I wanted to hold
I mean,
space.
those things you can do off record,
Yes.
offline. You can go talk to the members on the other side. But I think I'm not going to go that debate here. So if they are not willing to answer, I don't see any hands up. So the only hand up is Mr. Major. If once you stop speaking, then I will go to the speaking list. Okay?
Well, I wanted myself to hold space for them to answer that query because, as you say, Chair, nobody can definitively say 100% how they're going to vote until they do vote. But I think most of the members in this House, most of the members on this committee, and most of the members on the opposite side are people of integrity who, if they go on the record with the cameras on, which thankfully the cameras are on today, to say that they'll vote one way or another, then I would generally trust that, and then I'd be willing to move forward to a vote. But I think as I haven't seen, or as you haven't seen, Chair, any hands go up, that we better discuss this motion further. So I do want to inform the committee that there are literally thousands of epidemiologic and other medical papers on HIV in Manitoba. And I think before we proceed with yet another study on HIV in Manitoba, we ought to consider some of the research that is out there. So I'm delighted to be able to talk with you all today about a study I found on this topic. It's in the International Journal of Infectious Diseases Regions. The International Journal of Infectious Diseases is one of the premier journals in the field. Their subjournal, Regions, deals specifically with communicable diseases in regions, and in this case, Manitoba. So although I have not fully critically reviewed the study that I'm going to be talking about for the next while, it is in a high quality scholarly source. So I hope that we'll all take its findings really seriously. The lead author on the paper is Megan Sorokopud-Jones, who I understand to be in the Division of General Internal Medicine at the University of Manitoba, so very much on the ground. The objectives of the paper are to describe the proportions of people newly living with HIV with sexually transmitted and blood-borne infections before, at, and after HIV diagnosis in Manitoba, Canada. So I think that's really topical because as the motion as amended includes syphilis, then I think that this will touch both on this paper and on our study. And the paper is published just in December 2024, so quite topical and really perhaps ahead of the wave in terms of what was about to happen with the increased number of cases we're seeing of HIV in Manitoba presently. So the paper says that people living with HIV immunodeficiency virus, immunodeficiency virus, with additional sexually transmitted and bloodborne infections have poorer health outcomes than people with just one. I suppose that's not terribly surprising. STBBIs, that is sexually transmitted and bloodborne infections, can cause an inflammatory response leading to the release of cytokines and immune cells in the genital tract, which can increase the risk of HIV transmission and acquisition. Having a syphilis infection has been shown to nearly triple one's risk of HIV acquisition. And in men who have sex with men, previous rectal gonorrhea or chlamydia and having multiple repeated sexually transmitted infections were associated with increased risk of HIV acquisition. People diagnosed with HIV co-infected with syphilis progress more frequently to neurosyphilis than controls. People living with HIV and concurrent hepatitis C virus have accelerated liver fibrosis, which may be caused by HIV viremia, HIV-associated immune dysfunction, or a side effect of antiretroviral therapy. Women living with HIV are more likely to have higher recurrence rates of genital herpes and genital ulcers from syphilis than women with HIV alone. In addition, women living with HIV who have PID, that is pelvic inflammatory disease, experience increased severity of symptoms and a greater probability of progressing to tubo-ovarian or fallopian tube abscess. In Manitoba, Canada, the total number of people newly living with HIV has increased 52% over the past 5 years. And I'll just bring the committee's attention to the fact that this was published in 2024, so it's probably written a bit before that. So this is a kind of a slow-moving catastrophe that we're now terming an urgent crisis. But it was noticeable. The signal was there. I take it as early as 2019. The demographic composition of individuals newly diagnosed with HIV has changed dramatically in Manitoba, with a recent sharp increase in females and injection drug use and heterosexual sex as primary risk factors for HIV acquisition. The increase in new HIV diagnoses has been partially linked to increased methamphetamine use in the province. Between 2013 and 2018, there was a 7-fold increase in the number of people documented as using methamphetamines in Manitoba. And those using methamphetamines were found to be younger adults living in lowest income areas and have comorbid mental health conditions. Alongside the increasing incidence of HIV, Manitoba also reported higher incidence of other STBBIs than national reports. The provincial test positivity for syphilis has doubled between 2018 and 21, and Manitoba continues to have the highest rate of infectious syphilis of all Canadian provinces. Furthermore, in 2019, there were 370 chlamydia and 94 gonorrhea diagnoses per 100,000 people nationally in Canada. But Manitoba reported 601 chlamydia and 272 gonorrhea diagnoses per 100,000 people. Manitoba also reported the highest rate of HCV of any province in 2019, with 54.2 diagnoses per 100,000 people. Substance use, houselessness severity, and female sex are associated with a greater prevalence of STBBIs. Previous research has shown that unstable housing was associated with HIV acquisition and affects the HIV continuum of care. Reduced treatment effectiveness and not receive appropriate HIV care. In a meta-analysis of studies of STBBIs, prevalence among American houseless adults, young women were found to have the highest prevalence of chlamydia and gonorrhea infections. Women living with HIV in Canada are increasingly additionally burdened by houselessness, food insecurities, and use of illicit substances. In 3 Canadian provinces, 79% of women living with HIV experienced food and or housing insecurity. Our study group recently found that females newly diagnosed with HIV are additionally burdened by houselessness, injection drug use, mostly methamphetamine, and mental health conditions. As part of a larger investigation of HIV syndemics in Manitoba, our primary objective was to describe the proportion of people diagnosed with syphilis, HCV, hepatitis B, gonorrhea, and chlamydia before, at, and after HIV diagnosis among people newly diagnosed with HIV in Manitoba between 2018 and 2021, by sex, housing status, injection drug use, and methamphetamine use. Our secondary objective was to identify the factors associated with syphilis, HCV, gonorrhea, or chlamydia acquisition, and any of the 4 STBBIs after HIV diagnosis. So that's just the introduction of the study. I'm interested to go through the rest. I don't see any liberal hands having gone up. I guess I want to say that when I look at the motion that's before us, and, you know, we had this brief discussion about Ms. Sidhu's amendment to add, I believe it was LGBT, only one Q, I, no A, and plus. Oh, sorry, I missed the 2 SL at the beginning. At the time, there was some confusion about which letters she had included and which she hadn't, and whether she'd included the Q for queer or the Q for questioning. But now, as I read the scholarly literature that's actually already out there, it sounds like this crisis in particular is not affecting that community, and I think I almost wonder if this committee erred in thinking that it was, and I wonder if that in itself was speaks to stigma and bias against that community to assume that because there is an HIV epidemic in Manitoba that it was pertaining to that community when at least from the scholarly literature before us, I don't see any evidence that it is. So not. I will let the chair interrupt me at any point if he sees Liberal hands come up, or I'd invite him to do that. But not if I'm not seeing any, I suspect he's not seeing any either. So I think we should continue to go through the study. So method, study design. All people referred to the Manitoba HIV program in Manitoba, Canada, and confirmed to be newly diagnosed with HIV by the Manitoba Health Epidemiology and Surveillance Unit between January 1st, 2018 and December 31st, 2021 were considered in this retrospective cohort study. This centralized program provides care to all people living with HIV in the entire province of Manitoba and has 3 HIV care sites in Manitoba, Health Sciences Centre and 9 Circles Community Health Centre in Winnipeg and 7th Street Health Access in Brandon. That's actually really interesting to me, and I think pertains to our motion that there is a centralized program that provides care to all people with HIV in Manitoba already. And I think perhaps it would make sense to to add Dr. Sorokupa Jones to the witness list as part of this study motion. I'm already grateful to her for informing me of this before we continue. Chair, I do understand that there are Liberal hands up now, so I'll cede my time, and we can perhaps return to this at a later point. But
Yeah, there is a switch. The other chair is disposed, but Mr. Bailey's actually next, and then Ms. Conans, and then me.
Thank you, Chair. I'd like to ask the analyst. If she could provide an estimate when the report could be reviewed, translated, and tabled in the House. An estimate.
Who would you ask? Sorry, I was not paying attention because I was looking at the list. Analyst. Did you catch that?
It's hard for us to provide an estimate given that we haven't heard the meetings yet, and it depends too on what members want to see in the report, how long you want the report to be. If the report is short, then it would take less time for us to produce.
I was more thinking about resources and the urgency of it, that we can actually produce this by July 22nd, or is this something that is going to take longer? And could translation be done? These type of questions, if you could provide anything to the committee.
We'd have to touch base with the House of Commons Publication Service to see what their translation deadlines are at the moment.
So would you be able to get back to us on that by Thursday?
I could contact them and see if we could find an answer for you.
Thank you. And I wanted to add a few things because I actually Googled similar to what Dr. Strauss did, and I was really surprised that our government has spent $44 million on HIV studies in the last few years, and I want to make sure that these studies are being utilized.
point of order, Chair.
Yes, Mr. Strauss.
I'm wondering if the clerk could advise us as to whether all of the documents ordered by this committee from Canada Health InfoWay have been received.
Good question. No, we have not received all of them.
Could she advise us when they will be received, or if she'll be enforcing?
It's only up to them. You're still waiting for responses. There's no indication from Canada Health InfoWay of when they decide to respond.
Thank you, Chair.
Kind of weird in itself.
Thank you, Chair. So what my point was is we've got the Public Health Agency of Canada, we've got the Canadian Institute of Health Research that has spent over $44 million. And this is just a simple Google search that has indicated this to me. I would like to know how we can use these studies, like as an analysis. Can you start to print some of this out and share it and give us some of the findings? I'm very interested in the one that Matt just was talking about, directly pertinent to Manitoba. But this simple Google search has told me the surveillance and I can read it, but I don't want to waste the committee's time. Can the analysis help us use some of these already done studies to help us with our study? Through the chair. Sorry, Chair, I caught you off guard. A very simple question. There's all these studies that have been done by our federal government, $44 million worth of studies. I am wondering if the analysis can go weed through them, give us just like the basic facts that Dr. Strauss was talking about, to help advise us on how we're going to request our experts, because I don't want to be double doing stuff that we've already spent $44 million on, because there is some really good material here.
Okay, thank you. We will see what we can do, and I will talk to the analysts later on. Right now, the debate is still, there's lots of people on the list, and if that is necessary, we will circulate. But right now, we don't even know whether motion is going to go through and whatnot. So let me go. You still have the floor. You want to continue, or we go to Madam Konaz?
No, Chair, I'm going to just read this study because I think it's so important that everyone understands what I'm talking about. I was hoping that. So the government reports continuously tracks new HIV infections and progress towards, it's called UN-AIDS, 95 goals. 95% of the people with HIV diagnosis, 95% of treatment, and 95% virtually suppressed. So the diagnosis rates in Canada in 2024 reports 2,288 new HIV diagnoses. Prior to this, reports had observed a spike. With the HIV in Canada surveillance report, this is one from December 31st, 2023, showing 2,434 diagnoses, representing a rebound and subsequent plateau post-COVID-19 pandemic. Progress towards national testing and treatment targets is summarized in the Canadian Progress Towards Ending the HIV Epidemic, another study that I would really like to learn more about. Series offering detailed breakdowns of the care continuums across different demographics. It even goes so far as to give the Canadian guidelines on pre- and post-exposure prophylaxis, which was a funded study that outlines the evidence-based recommendations for clinical indications and drug regimes. And then it goes into Health Canada synthesized medical data to evaluate the risk of sexual transmission between partners. And of course, this would get into some of the groups that we listed on our motion. The results of the study of the risk of HIV transmission supports the undetectable, untransmittable, U equals U consensus, providing that the risk of sexual HIV transmission is negligible when an individual is on an effective ART and has a suppressed viral load. So talking about another study is the surveillance details how HIV impacts priority groups. Now, this is where we get into some of these minority groups. And again, there is a cross-sectional investigation that was done, and I really feel that a lot of these studies that we've spent millions of dollars need to be taken into account with our committee study. For full access and professional guidance, monitoring data, methodologies, there is 2 organizations that are all part of our Canadian.ca portal, and it lists over 800 studies. So this is why I'm asking the analyst, how can we take all these studies that the government has spent $44 million on and implement them into our study, as opposed to trying to get all these professionals in and hearing them out in 2 meetings for that matter. So again, I would ask the analyst, and I don't know, Chair, how would she communicate that to us?
Mr. Bailey.
Yeah.
From my experience for many, many years in sitting on the committees, there are enormous number of reports are done. When the committee brings in a business, because we determine our own destination, what we want to do and how we want to proceed. Yeah. So the committee is trying to vote on this subject. So, I mean, not necessarily, there might be thousands and thousands of books that might be written on this in the past on HIV, syphilis. But the committee particularly want to focus in Manitoba on this in those 2 meetings. And my focus will be to keep that whole discussion to Manitoba and into this. So you can ask analysts as many questions you want, but I tell you right now, if the question should come to me, and I will only entertain, because if the fellows come in, the witnesses come in, they refer to those reports, and you want them to table those reports, then we can do that. But right now, I'm not going to ask analysts to produce any reports. Right now, their duty is to make sure that they take the notes of what's happening here, and once the committee decides to study this topic, and then we can determine all these things that you're asking, predetermined things that you're asking, and that's what my experience tells me. So let's focus on the motion as amended, and then and particularly in Manitoba, and we continue because I have a speaking order already, because after you we have Mr. Mazier, Madam Konas, Dr. Eopson, and Dr. Strauss. So there are quite a few people.
Thank you, Chair.
Okay.
And I will wind it
Chair?
up, and I just want...
Chair, just
Point of order?
Point of order. Just something that came across my desk here is it's talking about, and I'm reflecting a little bit on what conversation I had with the minister yesterday, and as far as the Ebola situation that's hitting the world, and as far as, and especially Canada.
Again,
I'm
I
wondering
tell you-
if I could seek UC to have the minister come in and give us the health committee a briefing on Thursday for on how our government is responding to Ebola.
On a point of order, he can ask a UC, is there a unanimous consent? No, there's no unanimous consent. I'm going back to Mr. Bailey. Mr. Bailey, floor yours.
Thank you, Chair. I sure understand what you're saying. I take this committee very seriously, and I think what you've told me is it becomes my responsibility to start to review it. I can't rely on the analysis, any of the staff to help me get prepared for these meetings. So I will take it upon myself to focus, like Dr. Strauss did, on some of these studies, because I believe that there is a lot of information that could help aid us in this study. And so I thank you.
Okay, Mr. We said Madam Konas and then Mr. Major. Sorry.
Thank you, Chair.
Madam Konas, please go ahead.
Thank you. Appreciate that. I must say I'm disappointed that this committee is not addressing the prescribed IT. I'm moving on.
Now, please, if you can, I tell you right now, you want to make my life easier and your easier. Everybody, let me focus on the motion as amended. And I'll tell you right now, if we focus on this right now, we get this out of the way, and then you can bring in new studies that you want to do. So let's focus on this and forget about this.
So we've
because
got a promise from the
I'm not
Liberal
gonna-
members
but-
that they will go on to
honestly, I tell you, Madam
prescribe
Konas, I have
IT
told you
or
time and
to
time
study?
again. Can I take a floor? I have told the members, I as a chair have a duty. Okay? And I tell you right now, I am doing a very fair and what it should be done. Right now, my focus is that committee should focus on the motion as amended. And I cannot give any promises to you because you are speaking to me, because you are not speaking to the members. Members have every right. You have every right to vote however you want to vote at the last minute. So we haven't even voted on this. So once we vote on this motion as amended, and then then those questions can be asked. So let's focus right now on this. And
Point of order.
Chair.
Okay, so point of order.
I think the member does have an absolute right to actually question the schedule of what's going to happen here in committee. It is right in the motion. It actually refers to a timetable of what we're going to talk about. But there's so many other issues that had to be, like, basically, this got sidelined because we were in on an emergency meeting. I thought we were going to actually talk about the emergency meeting, that 5 members thought this was really an important issue, prescribed IT and the whole $300 million boondoggle. But meanwhile, you won't even let a member talk about the schedule of what we're going to, of the meeting and how HIV is going to go.
Mr. Major, can
I think she
right now,
deserves a right to actually talk about the schedule.
Okay, Mr. Major, I didn't want to use this language, but I'm telling you right now, because this matter is to do with HIV, and if I see there is a intent of the members to filibuster this meeting, even though I'm not saying it, members have every right to speak. But what is next, we will determine right now, or with us right now, is this motion amended. That is the business of the day, and that's what I'm focusing. My duty is to make sure that I bring the members back to this. Members can speak for hours. I do not see, and I mean, whoever, like I'm giving you guys all the time that you need for the last 3 days or 4 days, 5 meetings, and I'm not stopping you here. So you have every right to speak. You continue to speak as soon as I exhaust the speaking list. Once the speaking list is exhausted, then I will call the vote. I'm giving you enough opportunity. I'm not intervening. So only where I'm intervening is where those decisions cannot be made at this point in time. So this point in time, I have a motion as amended in front of me, and I have to make sure that I focus the debate on this. Once it gets finalized, then we will come to all that you are asking me. So thank you, Madam Kunaz. Please go ahead.
Chair, I do want to say, I want this on the record. Every single one of those members are on their phones right now. We actually had a motion here about a disaster in this world, Ebola, and they're on their phones, not even paying attention. I want the public to know that.
You cannot
but
say
I
that.
will say,
again,
okay,
I tell you
take
right
it
now,
back.
what members are doing.
But what I say, I will take that back. But what I will say is I am seriously concerned that the minute we vote on this motion, that the Liberals will turn out the lights, that they will shut the door, as they have in the past, and put this behind in camera. Do I have a commitment that every single one of them will not close the door again, turn off the cameras to the public for 30 years, as they have done over and over and over again in this room? But
Asking for you, see.
Continue speaking. I'm not gonna entertain that question. You continue speaking, please.
okay, so we don't have a commitment that they will not shut the lights out to the public, to the Canadian public. Okay, then I want to make the following motion. Verbal motion. Given that Liberal. Excuse me? Verbal notice, sorry.
And again, I tell you right now, the honorable members, in the beginning of the meeting, because we are in 2 official languages, and I requested that if we do not want to take the committee time away from the important topics of HIV that we are studying. If you can circulate that motion by email, I would really appreciate that. But you have every right to read the motion, because, but you know that it's taking time away from this study. So you have every right. So you want to, I requested you.
Thank you,
if you
Chair.
want to circulate, fine. If you want to read, your choice.
As I said, it's an extremely important study, but I will give this verbal notice. Given that Liberals government's prescribed IT program costs Canadian taxpayers $300 million over 10 years and was quietly shut down in February 2026 after reaching fewer than 5% of Canadian prescriptions, meaning doctors are still faxing prescriptions in 2026 exactly as they were when the program launched. B. Michael Green served as President and Chief Executive Officer of Canada Health Infoway for over 11 years, overseeing every major decision related to the Prescribe IT program from its inception through its wind down, and was therefore the single most knowledgeable witness available to this committee. Mr. Green appeared before this committee on April 21st, 2026. He refused to disclose his own compensation when asked directly by members, claiming he did not have that information at hand and had to be instructed twice by the chair to provide it. D. Documents subsequently disclosed to this committee revealed that Mr. Green received nearly $900,000 in total compensation in fiscal year 2024-2025, including an at-risk bonus component that increased in the same fiscal year. The Infoway board voted to declare Prescribed IT unviable and begin winding down the program. E. Mr. Green was dismissed as CEO effective immediately on April 29, 2026, 8 days after his appearance before this committee, a decision taken by his own board that raises serious questions about his fitness to have led this program and the adequacy of the accountability mechanisms in place throughout its operation. F. When asked by committee members whether TELUS Health was the lowest bidder for the original Prescribe IT contract,
Point of order, Mr. Chair.
Mr. Green could not confirm
Chair.
this.
There is a
When
point
asked-
of, there is a point of order, Madam Konas.
Is that motion
Ma-
is distributed in both languages?
This is a verbal notice. She can read in one of the official languages, but I tell you right now, I have made a request in the beginning that if we, because I did not clearly say, because last week I did the same thing. I allowed the member to read the motion because they have every right to read the motion, but I requested if motions like this comes in because of the two official languages, instead of reading the motion, if we can have it circulated, but the member has decided not to circulate but read it, it's her right and she's doing that. So let it be Madam Konas.
Thank you. When asked by the committee members whether TELUS Health was the lowest bidder for the original Prescribe IT contract, Mr. Green could not confirm this. When asked how many companies competed for the contract, he did not know. And when asked whether Prescribe IT measurably reduced opioid-related harm or fraud, as Budget 2017 explicitly promised it would, he said he did not have that information. The committee summoned Michael Green, former President and Chief Executive Officer of Canada Health Infoway, to appear before the committee for no less than 2 hours on June the 9th, 2026. That's it.
So thank you, Madam Konas. Madam Konas have read this.
Unanimous consent?
This is fair for her to read it, but at the same time, but the question that Madam Sidhu raised through point of order, that's also very fair. Because if we want to save the time on this committee just focusing on HIV, these motions, if in future, can be circulated in both official languages.
Just asking for UC, it won't take time. Just asking for UC.
It's read. Only thing I allow is it's read in the motion. So read in the section. So now we'll move it on to Mr.
Point of order.
I haven't finished yet.
You haven't finished yet?
No.
So you continue then.
So there's no
a point of
UC.
order too. So I need to know when you are finished. Okay, because I would not interrupt you. Once you say you're done, you tell me please when you're done. Okay?
I asked for UC.
Is there a juicy? No juicy.
Okay.
Continue.
Then I will, do you have anything? Okay, then I will continue. Speaking about HIV, one thing that probably,
Madam Konas, I don't want to say directly, but I'm trying to say indirectly, being very professional and very fair. When we ask these, like half of the people don't even know what you were asking the GC, what you are reading, all those. Honestly, I tell you right now, because if I'm raising this, Mr. Major, I'm raising a fair. Because if I get it from a non-partisan sources, then I have to respect that, okay? And you got to respect that too. So now the floor is with Madam Konas.
Thank you. As I mentioned earlier, this is a very extremely important study and vote that we have coming forward eventually. But I think that it's important for this group to, for all the MPs to understand that this is, again, not just a Manitoba issue. This is an issue that throughout the country, including many people don't know my riding of Similkameen, South Okanagan, West Kootenay, that's in the interior of BC, has the second highest senior population in Canada of any riding. It has more people over 65 than any riding except a riding on Vancouver Island. And one thing that isn't mentioned in this motion, but which I wanted to speak about, was the serious issue with HIV infections in seniors. And it's something that is alarming, and also they are a vulnerable community that we're going to have to address when we do this HIV study. Extremely important. So one of the studies that, when I was doing some research on it, was a study that was done in the Journal of Infectious Diseases and Epidemiology, and it was a study done by Fan Sok, a scientist who was studying infectious diseases in older persons with HIV in Canada. This study was done, if you look it up, you can find it in Volume 5, Issue 4, 2019 in the Journal of Infectious Diseases and Epidemiology. So I will read this study so that we understand that, again, this is a highly vulnerable group that needs to be that we need to focus on when we do this study. So the background is that across the globe, the number of HIV those who have HIV that are 50 and over is growing exponentially. They live with a chronic illness because, despite its many benefits, the ART does not fully restore health and well-being. Treated HIV infection is characterized by persistent low-grade inflammation, residual immunodeficiency, and a variety of ART-induced toxicities. Excuse my being not being an MD. I might say some of these words I might not pronounce some of these words properly. The aging process itself, plus lifestyle behaviors such as smoking and alcohol or drug use, again, very, very persistent situation throughout Canada and BC, result in growing frailty of this population. Frailty refers to an impaired ability to fight off health challenges and to recover from bouts of illness. It is associated with a gradual decline in everyday function. While ART can completely suppress viral load, current data show that the life expectancy of persons with HIV is still 13 years shorter than that of HIV-negative age peers. It is, however, improving. Persons with HIV today face two major challenges. The first challenge is to suppress the original virus and fight off all opportunistic infections. The introduction of ART reduced the mortality rate from 28.4 per 100 person in 1995 to 8.8 per 100 person years in 1997. The incidence of opportunistic infections, such as, again, difficult to pronounce, many diseases, complex diseases, is also prevalent. The second challenge is more difficult to meet. It is to slow the pace of the aging process, which continues to be exceptionally rapid in persons with HIV. HIV in 50 and older individuals experience prematurely high rates of cardiovascular disease, cancer, and cognitive decline. It remains unclear whether HIV itself, its treatment, and associated side effects or other risk factors are responsible, but the natural aging process appears to be accelerated. Premature age-related comorbidities and the increased risk for adverse outcome of illness or frailty and even mortality remained characteristic of this population.
Sorry,
Excuse me, Chair?
it's your time.
Continue.
Continue
Thank you.
please.
Thank you. Once, let's see, the pathophysiology of inflammation resulting from HIV infection is impossible to distinguish from the inflammation associated with natural aging. Both consist of cell damage, then tissue damage, followed by organ damage and eventual organ failure. Initially, damage can be reversed, but once organs begin to degenerate, the process to death appears inevitable. The pathways in chronic HIV and aging are identical. The combination adds speed to the process. Firstly, the diagnosis of HIV tends to be delayed in older patients. Additionally, HIV in 50-plus age may be extra vulnerable to the toxic effects of treatments and the pharmacological interactions of combinations of medications. I just want to also say that in a place like the Similkameen, South Okanagan, West Kootenay, or throughout Canada, rural Canada, this is going to be even more, the effects of HIV are going to be even more exaggerated because so many people, thousands, do not have a doctor right now. They do not have a doctor, so they're going to be diagnosed much later than should be. And again, according to this report, it says, the study, it says that you will not be, it's sometimes hard to tell having HIV from normal aging process. So that it even more important to have a family doctor to see the initial results of that. And that is, again, in my riding alone, thousands of people do not have a family doctor. So the natural history of normal human aging versus natural history of aging with HIV can be seen in the figures that they have in this report or in this study. Data from the Joint United Nations Program on HIV/AIDS shows an increase in the over 50 HIV population from 2.8 million in 2006 to 4.2 million in 2014. In Africa alone, the estimate in 2014 was that more than 2 million individuals over 50 were living with HIV. A recent study reported that globally there was 5.7 million HIV individuals aged 50 or older in 2016, and this number was expected to increase to an estimated 7.5 million by 2020 if the treatment target was to be met. I'm I really recommend that everybody around this table research more about aging and senior population and HIV, and I look forward to looking at that in our study. I'm ready to cede my time to the next speaker.
Thank you. Now we go to Mr. Mazier. Please go ahead.
Thank you, Chair. And I learned a lot there from Ms. because I didn't realize just how much work has actually been done on HIV, and here we are again. We have to do another study, and just to see what's actually going on in Manitoba. And I thank the sponsor for this, for bringing this study forward. But I think a lot of people are listening in on this debate and why we're talking more about HIV and continuing on to bringing it up today versus leaving it for another day. I think it comes down to trust. I think as a committee as a whole, I think that trust has been broken. That we don't trust the Liberals are going to actually do anything on this as far as action. And in the study itself, it actually gives the Liberals some deadlines here. It gives by July 22nd. The committee continued to work throughout the summer, and they accepted that motion. But the problem is, and this is to the listening audience, we don't trust the Liberals that they're actually going to follow through with this. So, and because of this, we are keeping on talking about Prescribe IT, which is the reason why we submitted and just resubmitted the 1064, which I will give verbal notice on that as well. So the 1064 is an emergency meeting for everybody that's listening in on this. And we wanted to have an emergency meeting on, and this is the way the 1064 motion reads, that given Canadians deserve transparency and accountability on Prescribe IT, the committee summoned Michael Green, former president and CEO of Canada Health Infoway, and he was the chairman, that received $900,000 in reimbursement. That's not part of the, that's not, I'm sorry, Chair. That was not part
of the motion. I would not allow that. Mr. Mayor, you as a vice chair knows better.
Yes, I'm sorry for that.
Yeah.
So that the committee summoned Michael Green, former president and CEO of Canada Health Infoway, to testify in person for no less than 2 hours within 1 week of the adoption of this motion. And B, that the committee requests the Minister of Health and officials to testify before the committee on the $300 million Prescribe IT program no later than June 18th, 2026 for the entire meeting. And that the chair be instructed to schedule the minister's appearance at the earliest possible opportunity, including using additional resources by holding a meeting outside of the committee's regular schedule in order to accommodate the minister's availability if needed. So it's a pretty wide open 1064 motion. I thought we were going to get to that today.
Point of order, Chair.
But we have had, yes, sir.
I'm just wondering if you could seek unanimous consent to Mr. Mazur's motion.
I honestly, right now, you have no, I don't want you to do that because he have not finished the motion and he's just reading the motion, okay? It's not a motion.
I thought he was speaking to it
It's
now.
not a motion. He's just reading, and I'm not going to ask unanimous consent on this. All I'm allowing him is, because I have Dr. Strauss, through you, I mean, because it's not only focusing on you, I want to remind all other members. I can read it in the beginning, what I said today. I said before we begin, I would remind members that where possible, motion should be submitted by email in both official languages so they can be circulated without taking time away from the matters currently before the committee. Okay, I have requested members time and time again, if members are not listening to this request, but they have every right to read the motion, so I'm letting him only read the motion, and I'm not going to ask for a unanimous consent on this one. So, Mr. Mazier, floor is yours. Please continue.
Well, and I want to thank Mr. Strauss. That's a heck of a great idea. And in all fairness to the Liberals that are not paying attention, I mean, to this motion, so I will be seeking unanimous consent when I read it again. It was a verbal motion, but I am going to be seeking unanimous consent. So I'm asking the Liberals to listen to this. And then they can, I'm
Mr. Mazier,
I have the floor.
You as a vice chair, I want to tell you,
Yeah.
I want to correct you.
I cannot-
I have a right. I tell you right now. you have right to read the motion. You can only call a unanimous consent if you are going to present as a motion, okay? And I will see if the motion is in order. If the motion is not in order, then I can say I can take it away. But right now, your right is to read the motion, and I'm allowing you to read the motion. So please continue to read the motion.
Okay, well, I guess the bottom line was I was trying to get the Liberals' attention so they could seek, because Chair, just in all fairness, you've used, no, this is a point of order now.
No,
Because you've used the reason that they're not paying attention to this and they haven't really had any photocopy.
How do you say that they're not paying attention?
You said that.
No, it's
yourself.
not that.
Yes, you did.
I didn't
But
say that.
anyways,
I'm saying,
asking
in
them.
fact, if I said directly, it is you members, because they did not bring in a motion today. It's the Conservative members are bringing motion after motion, and I have not said it Liberals. I have not said Conservatives. I was
I know,
talking
that's my
general,
job.
but I know. But now you wanted me to say it, and it was the Conservatives. Okay, so continue to read.
Conservatives what?
They are the ones who are bringing motion. They are not paying attention to what I said earlier. You said the Liberals.
Yeah.
It's not Liberals.
Yeah,
okay?
well, actually, the 1064 motion is brought forward by Conservatives and the Bloc.
That's been dealt with.
And that's who signed off on this. And this is for emergency meeting to have on for Prescribe IT, and the CEO of Michael Green, former president and CEO of Canada Health Infoway. And I go back to my original statement about trust, and I think this is demonstrated. We sought unanimous consent. My colleague here, Mr. Strauss, asked for UC. That wasn't even acknowledged. I've asked for it through you, Chair, and asked the Liberals. There has been no uptake. There's been no arms going up at all. It's just to seek UC to get this done. So that is why and then we always go back to here. We're going to start talking. I'm still.
This is not a point of order. It's a debate. Just
I know. I'm
continue to
talking
read.
about my motion.
Just read the motion.
I'm still.
Okay. Please read the motion.
I'm still talking about my verbal motion.
I'm not going to let you debate on this one.
Okay.
Okay.
So
you just read it.
I will go back to. I did read it. I can read it again. The given
Not again.
Canadians.
Just start where you finished.
Okay. I'm not finished, but now I can continue on
wherever
with the
you-
verbal motion.
Okay.
So that, and I think, just so we're clear, that the committee requests the minister, the committee summoned Michael Green, former president and CEO of Canada Health Infoway, and the committee requests Minister of Health and officials to testify at committee on the Prescribe IT. That's what I was seeking unanimous consent on, just so we're clear, Chair. So now, I will go back to the other motion, back to the HIV motion. And it is actually directly links back to this, because I go back to my statement on trust. In our amendments, we did, was presented by Mr. Strauss, that was the amendment and the motion was no later than July 22nd, 2026. And honestly, that the purpose of completing this study and ensuring that this report tabled by July 22nd, 2026, when we're all risen. So
Point of order. I'm sorry to interrupt, Chair, but can you tell me what the speaking list is? I have one more thing that I would like to get across.
You are on the list, Mr.
So
So
what
I
is the
have
list?
Mr. Major.
Yeah.
He still have the floor because he has to read a notice which of motion. Then now he's speaking. So then we have Dr. A. Opson. Then we have Dr. Strauss, and then you, Mr. Bailey. So there's a long list.
Thank you, Chair.
Right? There's a long list, and I will entertain everybody. And I'm entertaining for the last 3-4 meetings since we are suspending. So don't you worry. Everybody will get their fair share, fair time. And so instead of interrupting Mr. Major, I will love to go back to you, Mr. Major.
Okay. And I would, I guess, I get your message. So I have another verbal motion, actually. So given that A, the Liberal government's Prescribe IT program spent $300 million in the Canadian taxpayer money over 10 years, reached fewer than 5% of Canadian prescriptions, and was quietly shut down in February 2026, with doctors still faxing prescriptions exactly as they were in the program launched. B, David Fast served as Executive Vice President of Finance and Chief Financial Officer of Canada Health Infoway throughout the operation of the Prescribe IT program, and was present at the November 12th, 2025 board meeting, at which the decision to wind down Prescribe IT was made, and is therefore among the most senior Infoway officials with direct knowledge of the programs of this is a verbal
Mazier.
motion.
So you want to bring in a motion?
This is a verbal motion.
Another
Verbal notice. Verbal notice.
You can continue, okay. So
Thank
if you're
you.
not.
Good
if-
language.
Okay.
Notice. Verbal
so
notice.
You should say that first,
I'm sorry. I
Okay.
thank you for keeping me on toes, Chair.
okay?
So
now
David
you can-
Fast served as Executive Vice President of Finance and Chief Financial Officer of Canada Health Infoway throughout the operation of the Prescribe IT program, and was present at the November 12th, 2025 board meeting, at which the decision to wind down Prescribe IT was made, and is therefore amongst the most senior Infoway officials with direct knowledge of the program's financial management from beginning to end. C. As the Chief Financial Officer, Mr. Fast has directly responsibility for financial controls, internal reporting, compensation frameworks, expenditure approvals, the fiscal oversight of an organization that received, and $300 million in federal public funds for Prescribe IT, and would have been the senior executive most closely involved in the preparation and approval of financial decisions that this committee has been able to obtain satisfactory answers on from other witnesses. And D, testimony before this committee on May 5th, 2026, confirmed that prior to joining Canada Health Infoway, David Fast served as president of AGFA Healthcare North America. My gosh. And that Michael Green, who served as president and CEO of Canada Health Infoway for over the decade, previously served as president and CEO of AGFA Healthcare, really, for the Americas region. Meaning, both men held senior leadership roles at the same private health technology company before, together, overseeing the Prescribe IT program. E. Testimony before this committee on May 5th, 2026, almost a month ago, further confirmed that Michael Green personally recommended David Fast for the interim CFO position at Canada Health Infoway, establishing a direct relationship between the two men that was never disclosed to this committee or to the Canadian public. F. Testimony before this committee on May 5th confirmed that the CFO position was never completely posted. Mr. Fast was brought in on an interim basis, a process that bypassed the competitive hiring standards that apply to senior executive appointments at a federally funded organization, and he remains in that interim role to this day, more than 2 years after his appointment. G. When this committee asked the chair of Canada Health Infoway how much money Canada Health Infoway has paid to AGFA Healthcare since 2017, the witness could not provide any figure, leaving open the question of whether the organization shared a financial relationship with the company where both its CEO and CFO previously held senior leadership roles, and whether any conflict of interest declarations were made in relationship to those two payments. H. When the former CEO of Canada Health Infoway, Michael Green, appeared before this committee on April 21st, 2026, he refused to disclose his own compensation when directly asked by members, claimed not to have that information at hand, and left the committee without providing a clear account of financial decisions made during his tenure. The person at Infoway best positioned to provide that account is the Chief Financial Officer. And I think we all remember that meeting and how we were all taken aback just, well,
Okay.
I
Folks to the
read
motion.
it. Page I, $10.2 million in additional expenditures flowed out of Health Canada Infoway after the November 2025 wind-down decision, with no complete public accounting of how that money was authorized, categorized, or spent. As CFO, Mr. Fast would have overseen or approved those expenditures and is in a unique position to account for them. J. InfoWay's own disclosures show that $167 million of the $300 million total was consumed by operations and overhead, of which $108 million was personal costs. $108 million of personal costs. Thank God. Representing a ratio of approximately $50 in administrative expenditure for every $1 of fee revenue the program generated. 50 to 1. No witness has yet explained to this committee how financial controls and value for money assessments were applied to those costs year after year, and that explanation must come from the organization chief financial officer. K. Mr. Fast has not appeared before this committee at any point during its investigation with direct knowledge of the financial decisions at the center of this investigation, and his absence represents a significant and unacceptable gap in the committee's ability to fulfill its accountability mandate on behalf of Canadians. The committee summoned David Fast, Chief Financial Officer of Canada Health InfoWay, for 2 hours to testify on the financial mismanagement related to $300 million prescribed IT program within 1 week of adoption of this motion. And with that, Mr. Chair, I will stop.
Thank you very much, the honorable members. I just want to tell you the committee rules. You might be wondered, because the same motion was brought forward by Mr. Bailey. So, same motion. So, even though every member has a right to read it in the notice, but the only member that will be able to raise it is Mr. Bailey. Just a minute, I'm going to suspend for a few minutes. I have to check with the clerk here. Clerk was, I was having discussion.
What did you find out with the clerk?
But I don't need to tell you. But I'm
Well,
gonna.
but you suspended the meeting.
I suspended the meeting.
Why did you suspend the
I'm
meeting?
giving you the direction now. Okay, that's where I took the floor.
Why did you suspend the meeting?
I suspended the meeting to give you the direction on this, because
On
any
what?
member, because, just a minute, let me speak. You want to speak? Continue to speak. Otherwise, if I have a mic, then let me speak, and then if you have questions, you can raise your hand, and I will entertain.
I'm interested in your decisions, Chair. That's why I'm asking.
The decision is this: the same motion. I want to first of all tell because members might be wondered. The same motion was brought forward by Mr. Bailey. Okay? Mr. Major have the right to read this in the notice, but when it comes to debate or discussion, Mr. Bailey will take the precedence. Okay, that's all I wanted to say. Now the floor goes back to Mr.
Point of clarification,
Opson.
Chair? So can we ask for unanimous consent on that motion then?
You can't.
You
Mr.
can't?
A. Opson, please go ahead. The floor is yours.
Thank you. I'm just, I'm glad that people do appreciate the importance of this study, and I'm hoping that we can, members can also see forward to allow this to go to a vote soon. Thank you.
Thank you, Mr. A. Opson. As I said earlier, if the list does not exist, so I cannot. So I have Dr. Strauss, Mr. Bailey, and Madam Konaz on the list. So, Dr. Strauss, floor yours.
Okay, well.
On HIV subject, okay, please.
Yeah, well, I guess I'm disappointed that we're going to have to continue to talk about the motion further.
You don't need to. If you want
No,
to call
but
a
we're going to
vote,
have to.
You're welcome
I'm
to.
disappointed
Right?
because we have to. I was hoping for Mr. Edelson to make a more substantial pronouncement than that. And the reason I was hoping for it is I think he's quite a nice guy, and I think he's a man of his word in general. And if he were to say that they were interested in studying Prescribe IT after his HIV study, which everyone here is really anxious to get to, then we wouldn't have to, I don't know, continue our preliminary considerations before moving to the HIV study. So, but I think as it is, we are going to have to continue those for how much time? I'm not sure. Possibly 3 years. There are more than 3 years worth of HIV studies in Manitoba that we could discuss. I think another thing, so the last time I was speaking, I said through you, Chair, that if a Liberal wanted to put up their hand and discuss about whether they would be interested in investigating Prescribe IT after the HIV study, I'm getting there.
I'm telling you right now,
Yeah.
my focus right now and my duty as a chair is to
Yes.
make sure that I bring you fellows to the subject of matter, which is HIV. So you can ask me 100 times the same question. The answer is same.
Yeah, I'm
right
not asking
now,
the question.
in front of us, because we are already at 5:30,
I know.
and I have speakers on the list.
Yes.
So I would have no, otherwise I have to, again, I will keep on suspending the meeting until I bring it to the vote, okay? Or until there is you guys make a decision otherwise. So my focus right now is you have the floor.
Yeah.
I have to give you the floor and you
Yeah.
focus your talk because I've given you floor time and time again
I know.
for the last
I appreciate it.
last 2 weeks. And
Yeah.
so you focus on this motion that is amended by
Yeah,
you.
well, I was just coming to
Okay?
it because what I was saying was just as I had asked through you whether we would be seeing any Liberal hands, I think I'm going to ask on a different topic now pertaining to the motion more exactly. So as we went through the paper by Dr. Sorokapa Jones, it's there in black and white pretty clearly that the present epidemic is not now and has not been over the last 5 years to do with increased rates among the 2SL LGBTQIA plus community. So as we've learned that in the study that I've been reading into the record, it just caused me to wonder whether the Liberals would like to reevaluate the amendment that added specific reference to that community to the motion, because it now seems inappropriate to me. In fact, it seems stigmatizing to me. This is not an epidemic centered on that community, so why would our motion say that we're going to consider the disproportionate impacts on that community? It seems inappropriate, and I don't think for members of that community that they would appreciate being, dragged into this discussion of communicable diseases that is not pertaining to them, according to the study that I have been reading. So I look forward to seeing some Liberal hands go up to address that point. I think it's an important point. I think before we start the study, we really ought to reconsider that. Yeah.
Can I suggest you something?
Yeah.
I can't go back and between Liberal, but if you want to have a sub amendment, right? Because you cannot bring a sub amendment to your own amended motion. So
Yeah.
if you're one of the members want to bring in a sub amendment, you have every right. So basically, that's the way to go instead of just going back and forth the way we want to proceed. So continue, please.
Yeah, well, I think for myself, as you say, I can't amend the motion, but also they have the vote, so nothing's getting passed unless they support it. And beyond that, whether they support it or they don't support it, I would appreciate their input. I love bipartisanship. I love collaboration. I would like to know, with this further information now being on the record, if they would like to retract or backtrack on that amendment, because I you know what, I think I'll go further. I don't think it might be. I think it is stigmatizing to the 2SL LGBTQIA plus community to have adopted that, and to in the motion to not be suggesting, be declaring that there are disproportionate impacts on the present epidemic in Manitoba to that community, when quite the contrary seems to be true. And not just in the study I was reading, but I saw there's a news bulletin from the Public Health Service in Manitoba underscoring this point, because I think it is an important point. I think if that misapprehension is further promulgated, that could expose members of the 2SL LGBTQIA++ community to further stigmatization. But not, and then so I'm just putting that on the floor because I want to make as much space as possible for them to provide their input on that consideration. But I guess I will continue talking until such time as they want to provide their input. So resuming our discussion of the study, I think we talked about that it's a retrospective cohort study, that that individuals who are referred to the centralized program in Manitoba, which, by the way, kudos to Manitoba. I practiced medicine in Ontario for a long time, and we do not have such a centralized service. Things are quite ad hoc. I guess surprising that even with this centralized service, unfortunately, the epidemic seems to be centered there presently. So who do they study? Well, they studied 18-year-olds or older who received a new HIV diagnosis in Manitoba during the study period and whose previous HIV test result was unknown or negative for HIV. So those are the individuals who were included. People previously diagnosed with HIV who were transferred to care in Manitoba from out of province or another country were excluded. Data were collected from medical records. The variables gathered at the time of HIV diagnosis included age in years, sex assigned at birth, female and male. No intersex was reported. So, and that makes me wonder because we left out the A in the motion, but we included the I. But if there were no I's in this paper, I wonder why the one was included and the other was not. Self-reported gender, sexual orientation, race, ethnicity, substance use, and route, and living in a rural or urban area. Houselessness, yes or no, was defined by self-reported houselessness, or if the treatment team documented houselessness or unstable housing. That's unfortunate to me, a little bit of editorializing here, because I think in the introduction they talked about how the severity of houselessness was associated independently with HIV infection in Manitoba during the study period. So kind of unfortunate, just reading in the study design, that they decided to treat it as a binary variable, when obviously the authors know very well that houselessness indeed is a spectrum. The outcomes were all diagnoses of STBBIs that a participant had documented from the start of their medical record, the earliest result being in 2010, until the time of data collection and were recorded. The final date of data inclusion was December 31st, 2022. Oh my, wow. So all of this they found out. What we're about to find out from the study is from data collected before December 1st of 2022. So this has been going on for quite some time. Yeah, so this is years later that our present study is taking this up. Our putative, hypothetical, perhaps, going to start HIV study as soon as some agreement is reached about also studying prescribed IT. So STBBIs detected more than 15 days before HIV diagnosis were classified as before HIV diagnosis. STBBIs within the time frame of 15 days before to 15 days after HIV diagnosis were classified as STBBIs at time of HIV diagnosis. STBBIs diagnosed more than 15 days after HIV diagnosis were classified as STBBIs after HIV diagnosis. That's pretty simple and logical, but I'm glad they spelled it out. STBBIs were defined as the following diagnoses and associated tests: gonorrhea and chlamydia, urine nucleic acid amplification test or swabs of the cervix and or anus, syphilis, rapid plasma reagent, venereal disease reference laboratory test, and treponema antibody serologic tests, hepatitis B, serologic test for hep B surface antigen and hep B core antibody, and HCV antibody serology and HCV RNA. Syphilis rapid plasma reagent, and I actually don't know how to pronounce that word, reagent, and venereal disease reference laboratory test titers were used to determine the number of distinct syphilis diagnoses. Titers that remained stable or changed in one direction, i.e. decreased or increased fourfold over time, were recorded as a single diagnosis. Titers that increased fourfold after a decrease were considered a syphilis reinfection and recorded as two separate diagnoses. Additional syphilis diagnoses were only recorded if there were decreasing titers followed by increasing titers suggestive of treatment between separate infections. Only the first positive treponemal antibody test was recorded because this test remains positive after syphilis infection. For gonorrhea and chlamydia diagnoses, if a positive test was followed by a negative test and subsequent positive test, the participant was recorded as having two distinct diagnoses. Each additional gonorrhea and chlamydia diagnosis recorded had to be separated from the next recorded case by a negative test result. If the participant had repeated positive gonorrhea and chlamydia tests without an interim negative test, it was assumed that the person had one untreated infection. The date of hepatitis B and C results were recorded as the first positive results only unless a person had evidence of HCV sustained virologic response followed by repeat positive testing. To avoid measurement bias, several records were reviewed by two reviewers to ensure consistency in data collection between reviewers. All people newly diagnosed with HIV in Manitoba during the study period were included, which minimized selection bias. That's really impressive, I think. All people newly diagnosed with HIV in Manitoba during the study period. Like, I don't think many jurisdictions can say that they have such excellent health records, probably as a function of having this centralized HIV service, that they can confidently put in black and white in their paper that they caught every single one of the positive HIV tests in this present research. Wow. Statistical methods. The rates of individual STBBIs before, at, and after HIV diagnosis were analyzed by sex at birth, injection drug use status, use of methamphetamines, and housing status. We also calculated the proportion of concomitant STBBIs, none, 1, 2, 3, 4, or more new STBBIs diagnoses before, at, and after HIV diagnosis by sex at birth. Injection drug use status, use of methamphetamines, and housing status. Finally, we calculated the number of new STBBIs diagnoses in females and males before, at, and after HIV diagnosis. A Fisher's exact test was used when a chi-square could not be appropriately applied for qualitative variables, and the Mann-Whitney U test for quantitative variables, the crude and adjusted relative risks, were calculated to identify the factors. Oh, sorry, Chair.
Dr. Strauss.
I'm just getting going.
Dr. Strauss, I know you are going to keep going for a long time, and we have Mr. Bailey and Madam Konaz on the list.
Yes.
Unfortunately, I have to suspend again, so debate on this motion will continue at the next meeting.
I think it's
So
a great
meeting-
cliffhanger. I know everyone's excited for